Justin Trudeau and his Liberal government today announced a series of tweaks to the Medicine Prices Review Board. Now, if you don't know what that is, it's a board that's existed for about 30 years, and its goal is to track prices in other countries to basically set a parameter for what drug prices should be like in Canada. Now, the Liberals have given it a bit more teeth. They've excluded a couple countries like the USA because their prices are deemed inflated. And this is the Liberals' latest effort to basically convince you that there's no need for single-payer pharmacare right now. The Liberals have been dithering on this issue for a long, long time. And under Justin Trudeau's reign alone, his Liberal Party has been sort of toying with the idea of a pharmacare plan, but they've been very, very unclear about what their goals are, what their vision is, if they even have a goal, or if they even have a vision. And so from Bill Morneau, we've heard in the last couple of years, he said, well, maybe we'll implement something that covers, all those people who don't have coverage right now. It'll be sort of a supplementary coverage for the 20% of Canadians who are either uninsured or underinsured, but we're not looking to implement a single-payer plan. Others have noted, like Patty Taylor, that's the current minister responsible for this portfolio. Well, she said that these tweaks to the Prices Review Board is essential in any long-term goal of a public pharmacare plan, but in that she's sort of implying that the immediate goal isn't a public pharmacare plan, because I think she's saying, at least from my reading of the Globe and Mail article that covered this, that the government is basically of the mind that we need to lower prices first and then create a public plan. But all of this flies in the face of the government's own report on the need for pharmacare reform. Eric Hoskins, he was a former cabinet minister in the Ontario Liberal government, did a report on the state of pharmaceutical access in Canada and what the response could be, and he came to a very clear recommendation. Canada needs a public pharmacare plan, but more than just a supplementary plan, Canada needs a universal, single-payer pharmacare plan, which is more or less analogous to the current public plan that we have with Medicare. You don't pay with your credit card, you pay with your health card. That's the ideal model. And it's not just for some people or for other people or for some medicines or for other medicines. The goal should be, at least over the medium to long term, to have universal coverage of all medications that Canadians need to save lives and improve quality of lives and to get better. The Liberals don't seem to be interested, though, in that report. These series of tweaks by Patty Taylor and the Trudeau government, and Bill Morneau's previous remarks, and their lack of a desire to tie themselves to Hoskins' specific recommendations, lead me to believe that the Liberals will, at the very best in this election, offer a patchwork plan that will fail to actually do what needs to be done, which is provide a universal system that guarantees to all Canadians access to their medications, and creating the sort of single-payer buying block that will be the single greatest effect in lowering medical prices. This Prices Review Board likely has a role to play in terms of studying and analyzing costs within and beyond Canada, but at the end of the day, what's going to solve medical prices above all is a single-payer plan, coast to coast to coast, working with the provincial governments to ensure Canadians get the medicine they need. Anything else, anything less, is a patchwork and is simply an effort by this Liberal government to not actually challenge the profit center that is private pharmacare insurance and private pharmacare sales. The Justin Trudeau Liberals don't want to actually provide all Canadians good universal single-payer healthcare. Because if they did, they would be implementing pharmacare, and they would be implementing dental care. And they would be doing it the right way, which is by raising taxes on the wealthy. Not just a couple points on income tax like they did in 2015 or after 2015, but on the capital gains and inheritances and wealth of the rich. Go after them where it can really have a major effect, and use that money to build a truly comprehensive head-to-toe healthcare system. But the solution here is being offered by Jagmeet Singh and the NDP, who have committed to a head-to-toe healthcare plan, which will include, in addition to dental care, for instance, will include a single-payer, universal pharmacare plan that will cover the medicines Canadians need regardless of income. And Jagmeet Singh doesn't care that this will require raising taxes heftily on the rich. And he doesn't care that this is going to be seen as a threat to the pharmaceutical industry and to the private insurance lobby. Because at the end of the day, it's not about liberal insiders, it's about what all Canadians need. So I think a lot of people are going to be very disappointed in Justin Trudeau. A lot of people voted for him because they wanted real progressive change. And his government promised real progressive change. And on this issue, they've been given the report by a fellow liberal that basically says, look, the way forward is universal single-payer pharmacare. And yet they're content with tweaks. And they're content with loose promises about inferior systems. But Canadians deserve better than that. Canadians deserve a pharmacare system that gives them absolute confidence that when they go to the doctor, which is covered, that they won't be stuck with a pharmaceutical bill they can't pay. And further to that, Canadians need confidence that if they get a minor tooth infection, a minor cavity, they need a routine dental checkup, that they can get that coverage, that they can get that care before it turns into something so major that they end up at a doctor or in the hospital regardless, and which will have to be paid for by the taxpayer. A universal system of Medicare that covers dental and that covers pharmaceuticals is required to fulfill Tommy Douglas's dream, yes, but it's also the best way to build a preventative Medicare system, because pharmaceuticals and dental care are often the sort of care that gets done before things get bad. That you need those pills so you don't get sicker, or you need those pills so you get better, or you need those pills to manage an illness so that it doesn't go out of control and you end up in the hospital. And you get those routine cavity fillings and checkups so that you don't get tooth infections, which can cause serious, serious health issues. Whether it's through a public system that takes care of people on their universal healthcare needs, or whether it's the healthcare system picking up from the fact that the private market doesn't actually give upwards of 20, 30 or more percent of Canadians the care they need, we will pay for it eventually. So why don't we pay for it through a single-payer system that guarantees every Canadian man, woman, and child universal human dignity when it comes to their health? It's the way to go forward, and we won't see it from Justin Trudeau and his Liberal Party, but we will see it from Jagmeet Singh and the NDP.